Welcome back to Senior Living NTX. My guest today is Stacey Crowley with Three Oaks Hospice, and she's going to tell us a little bit about hospice care today. Stacey, why don't you go ahead and tell the people a little bit?
Hi, I'm Stacey Crowley with Three Oaks Hospice based in Waxahachie.
How does Three Oaks Hospice tailor its care plans to meet the unique needs of each patient and their family?
So every patient and every family, we look at it by case scenario, essentially. So it depends on what their diagnoses are, what exactly the patient wishes are, and what exactly the caregiver wishes are, and we tailor it to exactly what they're wanting and what they're needing.
Okay, so it's not like here's the process written down. You kind of look at it case by case.
Yes.
And tailor each plan to each.
Yes, nobody fits into a certain category. Everything is per Mr. or Miss Patient, whoever, we tailor it to them.
Awesome. What support services does Three Oaks offer to assist family caregivers throughout the journey?
So we assist everybody involved. And whenever I say everybody involved, it's the patient, caregivers. They have a random aunt in Idaho that they want us to include. Okay. We'll include them. We also include the current healthcare team that they have and the previous healthcare team that they had. So the doctors, anybody that they had. We also go in and support them with our staff. So all of our nurses can help, all of our CNAs can help. We have a social worker on staff, our chaplain, and our doctor that we have on staff as well. So we cater everything to them.
Okay, awesome. Is there a limit? Because I heard you say, family members even out of state. Is there a limit to how many people can be involved in that process?
I wouldn't go crazy, but no, we try to include as many people as possible.
Okay. Awesome. How does Three Oaks Hospice coordinate care with a patient's existing healthcare provider to ensure continuity and comprehensive support?
So all of our nurses are, whenever you start with us, you have that nurse, unless for some crazy reason if they're sick or on vacation. But you have that nurse and it doesn't change. And so that nurse will go in and they coordinate all of their healthcare needs with the patient, the caregivers, and they also talk to our doctor on staff. So they're constantly coordinating all day long. And if they want to continue with their PCP, their primary care physician, if they want to continue with their PCP, our nurse and our doctor will also give all of them updates throughout the entire journey.
Okay. And I'm glad you said that was going to be one of my follow-up questions to this one. So it's y'all's doctor and nurse staff would do some kind of intake or coordination up front with the patient's PCP. Yes. So that they can all put a game plan together. So it's not just a transition into y'all. It's kind of more of a collaborative approach with everybody.
It's a solid merge. And sometimes if we just need to stay parallel with each other and just work with each other all day, we totally will. Okay. The entire time.
Awesome.
Yeah. Catered. Everything's catered.
Customized.
Customized everything.
What bereavement and grief support services are available to families after the passing of a loved one under Three Oaks' care?
So we have our social worker that's on staff. We also have our chaplain that's on staff. So they go out and we follow the families for about 13 months after they have passed. And if they need more care after that, we will totally take care of that and help them. But we give different resources. So different support groups that are local to our community or even surrounding where all we serve. There's a ton of different support groups, but we also have a ton of different booklets that we hand out to different patients, kind of depending on what's going on. We can also help with teenagers, little kids, all that stuff. So we cater really to the entire family.
Okay, that's awesome. I love that. So it's not just your patient, not just the loved one who's passing on, but it's the whole family.
Right. Caregivers, everybody.
Beyond.
Yes.
That are available. I learned something new today. I did not know that was a whole part of it, was going forward with the family.
Yeah. I will say there's one thing that we do that's kind of special. For the entire year or within that year, whenever somebody does pass, we have something towards the end of the year, usually about the last quarter, and it's a family celebration. So we celebrate all the families or all the patients that have passed throughout the year, and all the families are invited and whoever else would like to come.
I really do like that because it really kind of reaffirms that belief that it is the family and that there is care after, and that it is I can't think of the word, but like
we cater
collective.
Yeah. We cater the entire time, and not just only when they're on service with us, not whenever we're just taking care of them just within that time. It's even after they've passed. We check on the family and everybody. And I mean, if they're still calling, or if they still need us, rather, 2 or 3 years later, we're still here.
Awesome. I love that.
Yeah.
I love that. Is there anything else you want them to know about Three Oaks or hospice in general that they should consider?
Let's see. Three Oaks, as far as Three Oaks goes, it's an amazing company. Love the company. They pour into all of their patients and all of their caregivers without a doubt, 24/7, 365. And hospice is one of those, it's not always an exact end of life. It's not end of days. It is, you can plan early.
Okay.
Yeah.
That's one of my big things is it's never too early to start thinking about what will come.
Yeah.
Okay, awesome. So if they want to get a hold of you or they want to talk to you more about Three Oaks or hospice in general, how do they do that?
So you can contact me, Stacey Crowley, at 972-672-6209. That's my cell phone number.
Well, thank you so much for being here with us today, for letting us interview you. That's a lot of great information. I'm sure you're going to have a lot of people reach out to you. If this information was valuable, please share it with a friend and subscribe to Senior Living NTX so that you can catch our next videos when we post them. And you can find all of our other information at fritzrealtygroup.com for our blog post and Senior Living NTX podcast on your favorite podcast platform.